Hello everyone, I am R. Rupa, Assistant Professor from the Department of Nutrition and Dietetics, Trinity College for Women, Namakkal. In this presentation, I am going to discuss about therapeutic diets and its importance in preventing various diseases. Diet is an important as medicine in the treatment of various diseases. A modification in the diet or nutrients can cure certain diseases. Nutrition during illness should be adequate to prevent weight loss and weakness. Diet therapy, as the name indicates, is the treatment of diseases using diet. So the definition of diet therapy is concerned with recovery from illness and prevention of disease only based on diet. The characteristics of therapeutic diet are: first, you have to plan a diet according to the condition of the patient. Then the diet should be modified, and the diet should be planned by the dietitian according to the prescription given by the doctor, and they are used to supplement the medical or surgical treatment, and removing or adding certain foods should be done, and the change of nutrients, calorie content and texture should be modified depending upon the condition of the patient, and they may be increase or decreasing the energy values and increase or decreasing bulk in the diet, example high or low fiber diet, and the high calorie content or low calorie content, or high or low protein content. And the purpose of therapeutic diet are: first, you have to regulate the amount of food so that the patient can recover from illness based on the dietary condition, and the assist body organs to maintain normal function. That has to be help in digestion, to improve specific health condition, or increase or decrease in body weight, and to meet the metabolic needs of human body, and to prevent dehydration as there may be a loss of water in case of fever like condition, and to improve appetite, and to provide adequate nutrition during illness. And the basic principles of therapeutic diet are: first, the diet must be planned in relation to changes in metabolism occurring as a result. Diet must be planned according to habits of a patient, culture, religion, socioeconomic status, personal preference and disease condition. These has to be taken into account. Whatever diet is prescribed, there should be variety for selection. Hot food should be served hot and cold should be as cold. So these are all the principles that has to be followed in planning the diet. And the type of diet and used in hospitals are: there are normally 4 types of diet are followed in hospital diet. The first one is clear fluid diet, second is full fluid diet, third is soft diet, and fourth one is normal diet. First we will see about the clear fluid diet. Whenever an acute illness or surgery produces a marked intolerance for food that may be evident by nausea, vomiting or anorexia, diarrhea, it is advisable to restrict the intake of food. Clear fluid diet is suggested when there is acute infection, in acute inflammatory conditions of intestinal tract, operation of rectum or colon, and also it is also given to relieve the thirst, to supply water to tissues and aid in removal of gases. The diet is made up of only clear fluids. It is deficient in protein, calories, vitamins and minerals. Because it is made up only of clear fluid, it should not be continued for more than 24 to 48 hours, because the nutritional requirement can't be met in clear fluid diet. Diet is given at 1 to 2 hour interval. The use of clear fluid diet is it can be given before the operative period, or prior to colonoscopic examination, or after the operative period, example in abdominal surgery, and in acute gastroenteritis, and in temporary food tolerance. And the second type of diet that is followed in hospital is full fluid diet. Full fluid diet bridges the gap between the clear fluid and soft diet. It is used following operation and in acute gastroenteritis, infection and diarrhea. The diet is entirely adequate and may be used over a long period of time without fear of any deficiencies, because nutritional requirement can be met in full fluid diet. Diet is given every 2 to 4 hour interval, and the uses of full liquid diet are: they can be given after the operative period, or in acute gastritis, infections, and in oral surgery patients, plastic surgery of neck or face area, chewing and swallowing dysfunction patients can be recommended with full fluid diet, and intolerant The third type of diet which is followed in hospital is soft diet. It may be used in acute infections following surgery and for patients who are unable to chew. The soft diet is made up of simple, easily digestible food and contain no more fiber. Patients with dental problems are given mechanically soft diet. Then the use of soft dieters while processing to full fluid diet to general diet, the soft dieters in the intermediate period soft diet is given. Then after the post-operative period, the soft diet is prescribed and in diarrhea condition and also in infection condition. The mechanical soft diet means many people require soft diet simply because they have no teeth. Example in older patients, and such diet is known as mechanical diet or dental soft diet. The normal diet, that is the fourth type of diet that is followed in hospitals, it is used for ambulatory and bed patients who can able to tolerate the normal diet and whose condition do not necessitate a special diet, that is the full fluid or clear fluid diet as one of the routine diets. The therapeutic diets for malnourished people, that is with deficiency people, are they should be prescribed with high energy and high protein foods, and the energy and nutrient dense food should be given. Pick foods from the menu which can be fortified, and the use of supplement recipe with fortification. Examine what the resident like to eat and encourage those type of foods. These things has to be followed in planning a menu for malnourished patients. The general dietary guidelines that has to be followed are: eat a variety of food, maintain ideal body weight, avoid excess fat and cholesterol, eat foods with adequate dietary fiber, avoid excess sugar and excess salt. Thank you and stay healthy forever.